How's it going, guys? So this is Dr. Suh at Specific Chiropractic, providing Gonstead Chiropractic in NYC. So as we see over here, we have a special guest over here. It goes without saying, you've got a lot of trouble walking on there. And you flew over from Atlanta, Georgia, huh?
Yes.
All right, so clue us in. What's been going on?
I've been having lower back pains, tingling and numbness in my legs, my lower legs. They're weak, and numbness in my right leg.
Okay. So you said about numbness in right leg. Where does it go from where to where? Where does it start from, sir?
It's in my hip, and then it starts right here from my knee all the way down to my toes.
Okay, and which toes is the problem, sir? You notice?
On my right foot, it's mainly these right here.
These toes right over here?
Yes.
Understood.
And these is the same. It's on my all my toes, but it's more
on the outside of the toes.
Yeah.
Got it.
Very weak.
Got it. Okay. We also see to the viewers as well. The ankles are swollen, but the right side is more swollen than the left. And it's swollen to the point that it looks like it's chronic for a long time because this is shiny over here, shiny over here, and you also lost the hair. So he has a lot of hair on the top part of the legs, but not the lower 1/3 of the legs. So this is the vascular system is compromised on this patient over here. All right, let's go ahead, let's take a look, see what's going on. All right, start with instrumentation right over here. Purpose of this device is we're looking for any abnormal temperature. And the deal is this: when a structure gets damaged, it starts that inflammatory process. So we're looking for any abnormal temperature, swelling, and you see over here the reading is going to the right on this fella right there. So we're going to take a closer look. Pain right here?
Yes.
What about underneath?
Not so bad.
Not too bad, but the top part is?
Yes.
What over here?
Yes.
Okay. What over here? Not too bad, huh?
Not too bad. Yeah. That's,
a little pain here?
yeah, a little pain.
Got it. How's that, sir?
Not too bad.
Not too bad.
Yeah.
It's a little bit stuck there. But this is not budging whatsoever. That's not moving. Okay, that's not moving. All right. How's that fella right there, sir?
Yeah, not too bad. Yeah.
It doesn't feel like great either, huh? Right there, huh?
Yes.
There it is right there, right?
Yes.
That's lumbar. Got it. All right. And this fella, not too bad?
Yes. Yeah. It's good.
A little bit there, huh? Yeah, a little bit jammed up. All right. Okay, sir, go ahead. You're going to march in place. Raise up your... Okay. Okay, that's jammed up. That's not moving whatsoever. Whoa, you okay? Okay, we're going to stop right there. Can you do one more? Okay, try one more. Okay, stop right there. All right, so I know it's a little quick to show to the viewers, but story is this: on his PSIS, normal is supposed to move downwards. On his right over here, it wasn't moving at all. And when I checked on the PIEX, this thing was moving underneath just fine, but this one over here, it was deviating towards this way. Now, combining all the data, as we saw earlier, how you were walking, I was looking at your foot. Your foot was torn inwards,
Yes.
correct?
Yes.
Now, the story is this: when we start to have this hip over here, and we were rotating externallywards, the leg itself, everything is also rotating as well. So that can help explain what's going on with the intoeing as well. Now, based on examinations, we did find, it says, okay, as this hip itself starts to go backwards over here, starts to open up this gap over here. And that's what we're feeling over here. There's a lot of swelling on the top part. And as this hip bone was going on outside, it opened this gap. That's why there's a lot of swelling over here as well. Okay. All right. So this pretty much helps confirm that, yeah, it's pretty much a good bet. This right hip's the problem. Now, we did the delay assessment, and also based on these x-rays over here, help confirm what we're looking at. The sacrum over here, normal angle, I want to see it around here. What I don't want to see is very interior like this.
Yeah.
Now, biomechanically, what causes this fellow to be like this is really going to be that right PIEX ilium over here. So now, but here's the trick. This is for the young students and docs over here. The additional challenge what we got here is the fact that most of the time when this fellow over here goes backwards and also externally rotates this way, ideally we want to see all the bones going towards the right side. Okay, that's not the case. We have the opposite direction. All right. So in the Gonstead work, we usually do like a PIEX pull, but you can't do that because what happened is they'll just make that fellow a lot, not such a happy camper. Because when the effect does is that because all the spinuses are rotated towards the right, if we pull it, all your low back lumbar spines over here is going to be further to the left. You're not going to be a happy camper. So what I've got to do is, we're going to do a push maneuver on this side, kind of like here, and we're going to knock out 2 birds, 1 stone. We're going to take out that rotation and center all these lumbar spines in the middle over here. All right, let's get to work. No. Come on up, sir. Go ahead. Take a walk, sir.
Don't feel too much pain anymore right here.
Well, not too much pain on that right hip anymore?
Not too much pain in my right hip.
Any other changes, sir?
No.
Would you have a seat, sir? Any other differences you notice, sir?
It's like I feel lighter or something.
Yeah, that's pretty good for me.
Like I feel lighter.
What about the numbness going down on the outside of your toes there?
It's pretty much gone.
Say again?
It's pretty much gone.
Pretty much gone.
Yes. I can wiggle my toes like that.
How do you like that? Yeah, that's pretty sweet.
Yeah. I can my last 3 toes I couldn't do that strong.
Yeah, that's great. That's absolutely great. All right. So here's the story. Now, because you traveled from Atlanta, Georgia, and you're only here for 1 day, okay? Here's the story. There's a great Gonstead doc in Atlanta, Georgia. We'll refer you to him over there, okay? In the meantime, what you do is this, because you're going to go on that plane ride back home, okay? This fellow over here, it's very unstable. It's not going to stay put, okay? So don't wait too long. Make an appointment with them ASAP, okay? I want you to put a cold pack over here. You're going to ice that fellow down 20 minutes every 2 hours. You're going to pump all that swelling out of that joint, right? And as that thing starts to heal and calm down, you'll notice everything else will start calming down. You start to notice your gait, your walking ability is going to start improving, and even the numbness going on your toes is going to start improving even more. All right? Any other questions for me?
Well, I feel less tingling in my left foot.
Hey, that's a great thing. Oh, there's one more thing I want to cover on the x-ray. Your 5th lumbar bone, right? Pretty much what we did is we knocked out 2 birds, 1 stone. This fellow over here, okay, as you see that nerve, okay, comes out of that tunnel.
Yeah.
Now, because your 5th lumbar bone, what happened was it went backwards and tilted this way as well. So in essence, that pinched that nerve over there. Okay, that's what you're feeling, all that problem going down to your toes over there. But actually, I was expecting more of your middle toes, which you are, complaining about, number 3, 4, and 5. But the 5th toe is usually the sacral nerve. But I just tested on you, and I do see in the X-ray, you do have a potential problem on that 2S over there. It may start showing up sometime in the future. Just want to give you the heads up on that. That may need to be addressed, and the doc over there you may need to adjust that from time to time. But for the most part, because this bone over here, it's way backwards like this, okay?
Yes.
By correcting your right hip, eventually, what happens is this sacrum over here, it starts to go back into normal angle. And indirectly, it starts moving this fifth lumbar back into position as well, right? But it probably may need a helping hand from time to time to try to push that vertebrae back onto the foundation itself, right? So that's going to be the long-term strategy with you, sir.
Okay.
Ja, så even så går det av måste nog.
Okay, close in. How are things for standing wise?
Standing wise, I feel a little bit more stable, a lot more stable. And my lower legs I feel I got more strength in my lower legs and less tingling in my feet and my toes, less tingling.
So you just told me when you were changing out of there, about to leave, how are things putting your socks back on, your shoes back on?
Yes, my right foot, I couldn't put my shoe on with a sock.
Uh-huh.
Now I got a sock on with my shoe. I couldn't, it was too tight. So now I put my sock on.
Nice. And how's the tingling and everything else?
The tingling is pretty much gone in my right foot.
Uh-huh.
It's gone, right? It's gone now. And I have a small percentage in my left foot.
All right. And how are things when you're walking?
I feel when I'm walking, I feel more stable and like straight up. I feel more straight than I was bent over walking. Now I feel stronger and lighter.
Oh, nice. How much improvement would you say you started from, at the very beginning till now?
I say, how much time?
Improvement.
I say 60%.
50-60% improvement. That's a good start. So like I said, I wish you could stay a little longer, sir, but it's just, it is what it is. So we got some doc and Lionel Jordan, he'll take over, all right, and get you the rest of the way over there.
Okay.
Okay, sir, once again, it's a pleasure. You got a safe trip back on.
Thank you.